pay for medical expenses when you're sick or injured. Instead of paying the full cost out of your own pocket, you pay a monthly fee called a premium. Then, when you need medical care, your insurance helps cover part of the cost. So let's look at a few key terms related to health insurance. First, a premium. This is the monthly fee you pay to maintain your health insurance coverage, much like a subscription fee for a service you use regularly. It's an essential part of keeping your coverage active and ensuring you have access to medical care when you need it. Next up is a deductible. This is the amount you're responsible for paying out of your own pocket before your insurance starts to cover your medical expenses. For example, if your deductible is $1,000, you'll need to pay the first $1,000 of medical expenses yourself before insurance begins to contribute. Now let's talk about copayments or copays. These are fixed amounts you pay for certain medical services, such as doctor's visits or prescription medications, usually at the time of service. For instance, you might have a $20 copay for each doctor's visit. And it's important to understand that copays are separate from your deductible and can vary depending on the service. So moving on to out-of-pocket maximum. This is going to be the maximum amount you'll have to pay for covered services within a plan year. Once you reach your limit, your insurance will cover 100% of covered services for the remainder of the year. That excludes your monthly premiums. And understanding this out-of-pocket maximum helps you budget and avoid unexpected expenses. Now, with regard to networks, health insurance plans often have a network of doctors, hospitals, and other healthcare providers with whom they have negotiated discounted rates. So, staying within your plan's network typically results in lower cost compared to going out of network. You should go ahead and familiarize yourself with your plan's network to help you make those informed decisions and minimize the cost. And finally, a health savings account, or an HSA, is money that comes from your paycheck, which is pre-taxed, that allows you to pay for qualified medical expenses. It's important to remember that this is an optional service and not required within a health insurance plan. So, what is Medicaid in regard to health insurance? Medicaid is a joint federal and state program that provides health insurance to low-income individuals, families, children, and other populations. It's designed to ensure that the vulnerable populations have access to necessary medical care and services, regardless of their ability to pay. Since we at the Washington County Department serve Maryland, we'll be discussing Medicaid within the context of the state of Maryland. So let's explore the differences between Medicaid and private insurance, particularly in terms of key concepts we just discussed a bit earlier. So let's start with premiums. Unlike private insurance, where individuals pay that monthly premium, Medicaid recipients generally do not pay premiums. And this is because Medicaid is funded jointly by the federal and state governments, with costs covered primarily by taxes. Moving on to deductibles. While many private insurance plans require individuals to meet that deductible before coverage kicks in, Medicaid often has minimal or no deductibles. With regard to copayments, similar to deductibles, Medicaid may have lower or no copayments for covered services compared to private insurance plans. And if they are required, they're generally never going to be more than 5% of your family's income. Same thing with out-of-pocket maximums. Similar to copayments, these vary depending on state and the specific Medicaid program, but however, they're never going to be more than 5% of your family income. With regard to a network, Medicaid actually offers a broader network of providers, including safety net hospitals and community health centers, to ensure access for enrollees. And finally, unfortunately, being a recipient of Medicaid uh, makes you unqualified for a health savings account. So let's take a closer look at Medicaid eligibility requirements, specifically for the residents of Maryland. In Maryland, a few requirements include being a US citizen, having an immigration status, and recently, thanks to the expansion of the Medicaid program via the Affordable Care Act, now includes pregnant and postpartum individuals. In Maryland, eligibility for Medicaid is primarily based on income. To qualify for Medicaid in the state, individuals and families must have incomes below certain thresholds set by the Maryland Medicaid program. And these income limits vary depending on factors such as family size and household composition. So here's a brief overview of the income requirements for Maryland households. However, it's really important to note that you should still inquire about your income eligibility with an insurance navigator with some resources that we're going to mention later on in this webinar. So what's covered under Medicaid? So Medicaid provides a wide array of essential healthcare services, including doctor's visits, dental care, prescription drugs, mental health care, hospital care, lab work and tests, and many more essential services to ensure individuals have access to the care they need. How do you apply for Medicaid? So, to apply for Medicaid in the state of Maryland, individuals can use the Maryland Health Connection, the state's official health insurance marketplace, or go through the state's official government health site, which is health.maryland.gov. The application process may involve providing documentation of income, citizenship or immigration status, and other relevant information to determine eligibility. So the following documents that show eligibility are the following: birth dates of family or household members, social security numbers, documents that include proof of citizenship or immigration status, tax returns for previous years, employer income information, policy numbers for any current health insurance, information about any job-related coverage, and a photo ID if you're applying in person. Ensuring you have these documents ready will help streamline the application process and ensure accurate eligibility determination. Let's take a closer look on how to apply through Maryland Health Connection.
So now you're ready to apply for health coverage at Maryland Health Connection, the state's health insurance marketplace. This new online application makes applying easier. This is where you enter the information for you and your family, so you can see if you're eligible for a break in your monthly premiums for private insurance, or if you or anyone in your family is eligible for Medicaid, all in one place. Here's what you may need to apply: your address and the birth dates of your family members, social security numbers or document numbers for any legal immigrants who need insurance, employer and income information for everyone in your family, like a pay stub or W-2 form, policy numbers for any current health insurance, information about any job-related health insurance available to your family. We ask about your income and the number of people in your family to let you know what coverage you qualify for and if you can get any help paying for it. We keep all the information you provide private and secure as required by law. If there is a change in your personal information during the year after you enroll for health coverage, make sure you let us know. Call our Consumer Support Center at 855-642-8572. You must submit true and complete information to find out your eligibility for public health programs or financial help with healthcare costs. At any step along the way, you can call our free phone line and speak with a trained representative. We also offer assistance in 200 languages and service for people who are deaf.
So what happens after enrollment? It's important to remember that Medicaid participants must re-enroll every 12 months. And usually, participants who have to renew their benefits will receive a letter in the mail letting individuals know that they are up for renewal. After that, they have up to 45 days after this notice to respond and renew via the mail, or you can go ahead and renew online. So again, it's important to work with your insurance navigator to make sure your account information is up to date. If you ever happen to lose Medicaid, you still have the option via low cost health insurance. And again, an insurance navigator can help you find the best plan for you. Now, where you're going to find these insurance navigators are most likely going to be within these resources pages. For more in-depth information on Maryland Medicaid that can help clarify any additional questions you may have, you should check out our site and AHEC West, a nonprofit organization whose mission is to improve access to and promote quality healthcare through education and collaboration. Here, you'll discover valuable information to help you understand and navigate the Medicaid program. Whether you're exploring eligibility criteria, seeking coverage options, or looking for assistance with enrollment, we're here to provide guidance every step of the way. Thank you so much for coming to this webinar. And a few things to remember before we end. The purpose of Medicare is to provide healthcare coverage for low-income individuals and families. Eligibility criteria can vary and include income level, family size, disability status, citizenship status, and other criteria. The Affordable Care Act has allowed states to expand coverage benefiting more low-income adults, specifically pregnant and postpartum individuals. Medicaid is so important. So it's important to work with your local government to build and sustain Medicaid for continued accessible and quality healthcare for those who need it. Thank you so much. And before we wrap up, Stephanie's going to put an exit poll. And Stephanie, whenever you're ready.
Okay, yep, just launched the questions now. Okay, just closed out the poll questions.
Thank you everyone for attending our webinar. We hope you have a really great day. And again, this webinar was recorded and it's going to be posted on YouTube at a later date for your reference.